is a war. It's happening now. It will decide the fate of humanity. The time to choose sides has come. We are the resistance. We are the InfoWar.
Welcome to the InfoWars Nightly News. I'm David Knight. It's Thursday, October 2nd, 2014. Here are our top stories.
Tonight, the CDC predicts a massive increase in Ebola by New Year's. Then, a sheriff's deputy gets 12 years for millions in laundered money. And the security theater of the Secret Service. That's next on the InfoWars Nightly News.
What you're spewing is conspiratorial hatred. It's racist, racist.
Well, a new study released by the CDC on September 26th, that's 4 days before we learned of patient 0 in Dallas. That new study posits that the number of cases in Liberia and Sierra Leone are growing at a much faster rate than previously thought. And of course, it is not under control, it is ever expanding. It was just 6 months ago that we learned of the first Ebola cases in Guinea. But of course, it's been Liberia and Sierra Leone where they've grown the fastest. And the CDC points out that the number of cases in Liberia is doubling every 15 to 20 days. Those in Sierra Leone are doubling every 30 to 40 days. Well, what does this look like? Remember that the population of Liberia is only just over 4 million people, about the size of the number of people that live in North Carolina. Yet they've had 3,000 cases of Ebola in just that one country, and about 2,000 of those people have died. If you normalize that to the United States, you'd be looking at numbers that were around 300,000 people getting Ebola and about 200,000 dying. So the assurances that we're getting from the leaders of our country that we have a robust, modern medical system that can handle this, I don't know that they can handle it if they get that many cases. And of course, they're saying now in another study that came out from the CDC that Ebola cases could reach at least 550,000 by January and up to 1.4 million in those two countries, in Liberia and Sierra Leone. Again, normalizing that to the population of those two countries, the combined population is about 10 million people. So we're looking at about 5% to 14% of the people in the country being sick with Ebola. Now, the first casualty of the pandemic has been the truth. It was just a couple of weeks ago, before we learned of patient 0, that Obama visited the CDC in Atlanta, the Centers for Disease Control and Prevention. That's a very unusual thing for a president to do, but then he made these pronouncements. He said, "Our experts here at the CDC and across our government agree that the chances of an Ebola outbreak here in the U.S. are extremely low. In the unlikely event someone with Ebola does reach our shores, we've taken new measures so that we're prepared here at home. Our nurses and medical staff are trained, are ready, and are able to deal with a possible case safely." And we saw just a few days later what happened when we had that case appear. They completely dropped the ball. Now, it's also interesting that the very day before he made these pronouncements, Paul Joseph Watson carried the story here at Infowars.com that the U.S. State Department had ordered 160,000 Ebola hazmat suits. So they weren't that confident, perhaps. Now, something else happened on that trip to the CDC, and that's all that the press is talking about. Of course, it led to the resignation of the head of the Secret Service. While at the CDC, Obama got into an elevator with a private security person who was armed at the time, and the Secret Service did not know it. But what they're not talking about is the fact that he's visiting the CDC. That in and of itself is highly unusual for a president, as well as the pronouncements that he's made. Now, of course, Chris Matthews is not very happy about the fact that he was assured by President Obama. Yet again, one of his promises doesn't come through. That tingle in his leg, I guess, is starting to turn to a fever. He had this to say to Ezekiel Emanuel.
The president said it would be unlikely if we had a case in this country. Unlikely to have even one case. Want to go back and see the tape again?
He said it wouldn't be an Ebola outbreak, and I think that's
no. And in the second part of his sentence, he said that in the unlikely case someone brings it here.
Yeah.
In the unlikely case somebody brings it here. Well, they've done it. We're living in the world of the unlikely already. That's all I'm saying. I'm not spear-mongering. I'm stating the facts.
We're still not getting the truth from the White House. It was just yesterday that the White House press secretary, Josh Earnest, told reporters there are screening procedures in place at our borders. Now, that simply isn't true. If you've flown, you know that the only thing they're looking for are taxable items. And we had a doctor who put on an Ebola protection suit to protest the CDC in Atlanta today. He was very upset about the fact that they're lying to people, misleading them about the risks. It's Dr. Gil Mobley. He checked in and cleared airport security wearing a mask, goggles, gloves, boots, and a hooded white jumpsuit emblazoned on the back with the words, "The CDC is lying." He said they're sugarcoating the risk of the virus spreading across the United States. He says if they're not lying, they're grossly incompetent. And he pointed out that when he did come into the country yesterday, the only thing they were asking people was if they had tobacco or alcohol. They only care about taxes. They're not interested in disease. Now, he also pointed out that once you start to get to a critical mass, as I mentioned, they're expecting that this is going to reach anywhere from 500,000 to 1.5 million in the two principal countries of the pandemic in Africa, Liberia and Sierra Leone. If that happens, he points out that we're going to get large clusters of people self-immigrating into the United States. What are we going to do to deal with that? Now, we had the Daily Caller point out yesterday that there are 13,500 people in those Ebola countries that currently hold a U.S. visa. It's not clear how many of those people are already in the United States and how many are in those countries and could legally enter the United States. Keep in mind that a visa is essentially our permission to those people, as our government is giving them permission to enter our country. Why can we not have conditions that there are health inspections on the people coming into our country from areas where there is a pandemic? We see that happening in the UK, even with animals, even with dogs. They are quarantined for 21 days from the US and from the EU. If they're coming in from other countries, they quarantine them for 30 days to protect dogs. Can't we have those same protections here in America? Well, of course, immigration is a subject that is loaded with political correctness. And Rand Paul pointed this out in an interview. He said political correctness is hindering our scientific decisions on the Ebola outbreak. Now, there's a couple of different ways that you could look at that. Is he talking about political correctness in terms of not being able to honestly talk about the risks of the disease? Or is it political correctness to not be able to talk about which countries people are coming from or excluding people from certain countries? We wouldn't want to do that, would we? Now, he was actually more focused on the transmission of the disease. He said, I really think it's being dominated by political correctness. We're not making sound, rational, scientific decisions on this. We should not underestimate the transmissibility of this. He said, my suspicion is that it's a lot more transmissible than if people who are taking every precaution are still getting it. There are people who are getting it who are simply helping people get in and out of a taxi cab. And of course, that is true. That's what we've been saying. Why have there been over 300 doctors and nurses who have died in that country? Is it simply carelessness? Is it fatigue? Or is it that they don't understand all the modes of transmission? Well, in a story breaking this afternoon from Paul Joseph Watson on INFOWARS.com, he points out that experts are saying that Ebola could be transmitted at a distance from infected victims. He quotes the doctors who put out the report saying, we believe there is scientific and epidemiologic evidence that Ebola virus has the potential to be transmitted via infectious aerosol particles, both near and at a distance from infected patients, which means that healthcare workers should be wearing respirators, not simply face masks. Making reference to controversy about whether Ebola virus can be transmitted via aerosol, the authors of the study assert that the current understanding that Ebola can only be transmitted by direct contact with virus-laden fluids is incorrect and outmoded. Absolutely. I believe that is true. I believe they don't understand fully the modes of transmission, and certainly those risks are not being communicated to the people in the countries adequately, and we're not seeing it truly and adequately given to the people of America because they simply don't believe that we can handle it. They think we're going to panic. Well, telling people lies and pretending that there aren't any problems when there really are is a surefire way to create hysteria and panic because you've lost your credibility. They're not going to believe you even when you tell the truth. But of course, there's another part of political correctness about that. We saw this from Nancy Pelosi just in the last couple of days at a press conference, again, on the issue of immigration, not necessarily about Ebola. They asked her about illegal aliens, and she pushed back on the reporter, and she said, are you referring to undocumented people in the United States? And the reporter responded, yes, ma'am, illegal aliens. And she said, oh, undocumented people, okay? That's what we see. That's the kind of political correctness that prevents us from actually addressing the reality of the situation, whether it's illegal immigration for economic reasons or for health reasons. Remember that the AP reversed itself just within a short 6-month period. They had defended the use of the term illegal alien, and when they first did it, they said that it makes it look like the illegal presence of the people that they're talking about is simply a matter of minor paperwork. That was the director of the AP that said that back in October of 2012. 6 months later, they reversed their position and said they would no longer use the terms illegal alien. They would only talk about undocumented workers. Jay Leno had it right. He said they're actually undocumented Democrats. Well, it's not just the political correctness. It's not just the semantics of saying it's not airborne when it's actually aerosols. It's also a crackdown, outright confrontation on free speech. And we saw this with Nancy Pelosi's press conference when she came down for a photo op at San Antonio. And Joe Biggs went down there as an INFOWARS reporter to try to ask her questions and was kept at a distance. They had to shout questions out to her. That's the way they control press conferences. That is standard operating procedure everywhere. It was just a couple of days ago that we had a reporter in Wisconsin who was creeped out and mad at the Obama Democrats who tried to attempt to stop her from talking to a crowd. Now, bear in mind, this is a reporter from a newspaper that had endorsed Barack Obama in 2008. They're very friendly to him. Yet she complained on Facebook and Twitter that aides to Michelle Obama and Democratic gubernatorial candidate Mary Burke told her that she could not talk to the crowd at a Burke event in Milwaukee. And what she said is, to say that I was creeped out is an understatement. This is what reporters do in America. We speak to people. At least that's how I've been doing things at all kinds of political events since 1979. Well, that's the sad state of affairs that we have. It's not enough that the White House press secretary tells us outright lies about how they're supposedly protecting us at the border. We're not allowed to talk to most government officials. Even the public information officers will refuse to talk to us in most cases at INFOWARS. They don't even allow friendly reporters now to talk to audience members. That's the amazing suppression of freedom of speech. It's going to get much worse if people like this reporter don't stand up and expose this. Stay with us. Right after the break, we're going to take a look at the ZMapp vaccine. It's been touted as a possible cure for Ebola, and they're ramping up production. It's the usual suspects: U.S. military, big tobacco, the Gates Foundation. Is it effective? Stay with us. We'll be right back.
In the past decade, we have witnessed unparalleled scientific discoveries in the area of health. But no one has put together a formula that focuses directly on brain health, nerve growth factors, and optimizing your cellular energy at the same time. DNA Force is one of the most expensive formulas to produce. Some of the ingredients in DNA Force are $12,000 a kilogram. We are using the coveted, patented, only American source of PQQ, CoQ10, and more. You want the best that's out there at the lowest price anywhere? Well, we're bringing you a total win-win. The ultimate value, cutting-edge, trailblazing game changer that also supports the InfoWar. We have produced a limited run of DNA Force, and it will take up to 12 weeks to produce more once we sell out. Secure your DNA Force today at InfoWarsLife.com or call toll-free 888-253-3139. DNA Force from InfoWars Life.
Celebrate the spirit of freedom and liberty upon which our nation was founded at InfoWarsShop.com. Molon Lave is ancient Greek for come and take it. This popular design combines both classic Greek Spartan imagery with modern M16 assault rifles. Now available in women's tees and proudly made in the USA. Celebrate the spirit of 1776 with the George Washington brass belt buckle or this incredibly sharp-looking 1776 hat. Badass. And be sure to check out the new arrivals at InfoWars Life, where you can prepare your body to perform at peak levels with Survival Shield Nascent Iodine, Super Male Vitality, and Fluoride Shield. And wake up, America. Immune Support Blend is the healthy choice for the gourmet coffee lover. So get incredibly high-quality, freedom-based products and help fund the revolution at InfoWarsShop.com.
Welcome back. Now, the New York Times reports that federal officials are planning to sharply increase the production of ZMapp. Now, of course, That's the vaccine developed for Ebola by a very small pharmaceutical company.